Welcome back, everybody. Now, the organizers of the 6th Annual African Health Exhibition and Congress, now that is the continent's largest healthcare exhibition and medical conference, have announced that it has partners with Childhood Cancer Foundation. I think you probably know it better as CHOC, South Africa, as its official charity for this year's event. According to the CEO of CHOC, the partnership with the African Health Exhibition will boost the income that will go a long way in supporting the organization's efforts. Well, joining us in studio to tell us a little bit more is Queiros, who is the CEO of CHOC. Good to have you, Carl.
Good morning to you and your viewers.
Yeah, very good morning to you as well. I imagine this is a big deal for CHOC.
It's a very big deal, and we're very grateful to the organisers. Not just the funding, but also the exposure will be very helpful to us, indeed.
Yeah. Tell us a little bit more about this African Health Exhibition.
Well, it's a congress that they bring together Africa specialists from around Africa and the country, and it's a non-profit training and information, so it's very useful to the health sector as well.
Yeah, and I mean, we were chatting about the dates. It's happening in June, so it's the 8th to the 10th of June.
Yes, at Gallagher Convention Centre.
In terms of funding, how is that going to work? How is CHOC going to be funded through all of this?
Well, there's a fee that the delegates pay, and that fee comes directly to CHOC. So it's actually it's a non-profit congress. So we get the proceeds.
That's really great.
Yeah.
So all proceeds go to CHOC for entrance into this exhibition.
Absolutely. Yes.
That is really, that's a great help. And I mean, obviously, if you have to look at the area that you need funding most, what would you say that you would use these funds for?
Well, there's two aspects. There's the care of children with cancer, and there's also the raising of awareness. So, as you know, the treatment of cancer is a long process. And apart from the emotional and the physical burden, it's also a financial burden on the family. So that's where we come in. But it's very important to raise awareness of childhood cancer, because there isn't much awareness of that in South Africa.
No, there certainly isn't. And I imagine also with children in less fortunate circumstances, it is even more difficult in terms of funding and helping there. How does CHOC assist?
Yeah, that's a good question, because particularly families that come from rural areas, low income, it's a big financial burden, because you come into the city, all the pediatric oncology wards on the major metropolitan areas, and you need accommodation, food, transport, just the general necessities. So CHOC provides all of that free of charge to every single family that's treated in a pediatric oncology ward in South Africa.
Yeah, no, it's an amazing organisation. It really is. But you're facing a very big uphill battle when it comes to fighting this, because I see recent research done, and I think you alluded to it as well. It appears that childhood cancer is on the rise, and it's becoming more prevalent. What is going on? Why are children getting cancer more and more?
Well, I'm not a medical doctor, so I don't think I can answer that question, but the international statistics is that it is on the rise. The prevalence is increasing, and we don't have comprehensive statistics in South Africa, but certainly we see the demand for CHOC services, and the number of new patients that we're coming across every year is increasing.
Yeah, I know that it would be interesting to actually chat to doctors and find out. I mean, I know a lot of people point towards the types of food that we're eating, the lifestyles that we're leading. I don't know.
Well, and if I can come in that regard, it is different, because childhood cancer is not a lifestyle disease. So with adult cancers, it can be lifestyle, smoking, drinking, and things like that. With children, it's not. So it's hereditary, it's environmental factors. But again, I'm not a medical doctor, but we definitely are seeing an increase in that. The good news about childhood cancer, it is largely curable. The challenge we have in South Africa is that we are diagnosing quite late, or children are getting treatment quite late because of the referral process. So this is where the awareness campaign comes in. It's very important that we get the message out there. And I actually have a vision to have awareness campaign right across South Africa, in every single city, village, township, so that people are aware of the symptoms. So if we can treat children earlier, there's a 70, 80, 90% chance of recovery.
Talk to me about the symptoms. What do we look out for?
Well, there's so many different types of cancers and different symptoms. And I think that's a challenge, because some of the symptoms are the same symptoms. So it's bloating of the stomach, it's redness in the eye. I wouldn't be able to do it just, but they can go into our website and have a look. We do have the Sensilion signs, which have all the major symptoms on our website, as well as the SABC website. And so there is information available, and they're welcome to call our offices if they want people have concerns and they want
concerns.
us to direct them to the right place.
That's a good idea. Look, I think all the details are going to be on the screen, or they are on the screen. The website is choc.org.za. The numbers of children, I mean, we're looking, the statistics I have in front of you, approximately 215,000 children under the age of 15 years old are diagnosed with cancer annually.
Globally.
This is a global figure. Bring it home. What do the figures look like?
So, as I said, unfortunately in South Africa we don't have comprehensive figures, but for CHOC, we come across most of the children that have been newly diagnosed, and we previously were looking at 600 a year, but now we're looking at this year probably going to be serving about 800-900 children. But the other problem is that it is significantly underdiagnosed, so we suspect that the real numbers are probably double that.
In terms of the kinds of cancer that affect children, is it again across the board? Can you not tell, or do you find that there's a certain type of cancer that affects children more?
Yeah, well, the cancers that affect children are different. So leukemia is the most common, sarcomas, but there's a wide range of them. But it's a different type of cancer, so the children react better to treatment, and that's again the good news about childhood cancer. If we can get them early, we can actually treat them well. The doctors can treat them well, and they can recover. Yeah,
so the key is early diagnosis. I suppose that's the key for anybody, whether you are a child or an adult. Early diagnosis is your key to survival. Yes. This exhibition, let's quickly touch on it. It's taking place, as we said, the 8th to the 10th of June. What kind of products, what are we looking at in terms of displays that are happening there? And if people do want to go down, and who is it really aimed towards?
It's aimed at the medical profession. I don't actually know too much about the exhibition, I have to admit. I haven't had a chance to get down there. But it's aimed at the medical profession, so it's both training, sharing information, there's exhibitions, there's various companies displaying their products and so forth. So for the medical profession, it's a great event, both for local and African delegates.
Yeah, fantastic. Well, listen, we wish you the best of luck. Keep up the amazing work. I must say, wherever I go, and I've sort of gotten into the cycling world, and I'm really enjoying it, and I always see your CHOC cyclists out there, the big cows, in their outfits doing their things. So just keep it up.
Well, thank you for the exposure, and we thank the Africa exhibition for their support.
Fantastic. This is Queiros. He's the CEO of CHOC, talking to us about this organisation of the 6th Annual African Health Exhibition and Congress that's going to be taking place here. It's actually the continent's largest healthcare exhibition and medical conference. It's happening in South Africa. I think it's in Johannesburg, is that correct?
In Gallagher Convention Centre.
All right, and that's on the 8th to the 10th of June, but more details about that closer to the time. But the great news that we're talking about is the fact that CHOC is going to be the beneficiary of all of the funds that come from this particular event when people do enter. So good on CHOC, and we hope they put that money to good use. All right, let's take